I will discuss at the end kind of what to expect over the next day or so. First, it's really important that folks stay connected to the information we're putting out as a community. These live streams will be happening regularly. They have been happening at 3 o'clock on certain days of the week, and we will continue to do so in the weeks ahead. Let me begin by saying that, as most people probably know, we currently have 12 positive cases of COVID-19 in Long Beach. We are heartened, of course, that 3 of those cases have recovered and are in recovery. So those patients are doing much better. But we are certainly concerned, as everyone should be, about the growing number of cases. It is important to know that as we do more testing, we will also have more cases. And I was discussing this with our health folks earlier today, but we do know that there is a shortage of tests and of the all of the materials that are needed to complete these tests. And so we would love to be doing more tests. As it relates to questions around when are we going to set up drive-through testing, or when will we have a larger testing system, we will be able to have those in place once the federal government sends us more tests. And so right now we are following CDC guidelines as to who should be tested when folks have symptoms. And I think our team is doing a very good job of that, but I want to make sure people know that we certainly would love to do more testing. We also know that beyond the 12 cases that are currently being monitored and folks that are isolated, we are actually monitoring an additional 130 people within the community. So it's a total of 130 that we're also monitoring as well. Let me also acknowledge that we know there's a lot happening from an economic perspective. And so I want to thank the Long Beach City Council who voted unanimously earlier this week to put in place some important measures for those in the community that have been wondering. So what is happening from an economic perspective? I want, first of all, people to know that we're looking at a wide range of economic relief for the community. One, we are putting in place an eviction moratorium if you're not able to pay your rent within the community. This also will be a prohibition on late fees and on Section 8 terminations. So if you are a renter in Long Beach, please know that over the next few months, and if you are affected by COVID-19, we are going to put in place some support for you so that you do not receive an eviction. And that is working its way through right now. For small businesses, we're putting an emergency loan program in place. We are putting in disability leave and a process to review sick time for all city employees that have to miss work because of COVID-19. We're looking at supporting all of our employees as well as small businesses and other laws across the city. We're also looking at parking. As folks are probably aware, we put a pause on parking citations as they relate to street sweeping throughout this week. And so while we are still street sweeping, we are not ticketing for street sweeping this week, and we'll be putting out more information in the next few days about what next week is going to look like as it relates to parking. However, parking enforcement for handicap zones, for red zones, those are still being currently enforced. Another important issue that just came up is the city is really proud that we just recently launched our Long Beach Community Relief Fund. This relief fund, in partnership with the Community Foundation, is going to allow us to support low-wage workers, seniors, people that need childcare with direct support through our nonprofits across the city. Folks can give to this fund by texting support LB to 50155, or they can just go to longbeach.gov, and there's a link right there to get everyone the information. I will share that in just under 24 hours of launching this fund, we have already raised almost, actually a little bit more than $250,000, which is substantial, and we're going to continue that work. And I want to thank everyone that's been involved in that. I also want to give some other updates on a couple other important items. The first, and this is really important for people to understand in the weeks ahead, there is absolutely not a food shortage. I understand that folks are concerned about groceries, about purchasing things at the store, but I want people to also know that all of the replenishments and the restocking, those are all on their way. And so I have personally talked to distributors through our network of mayors across the state, warehousing, and those that are actually making the food and supplies. And please know that, yes, while there is a shortage right now because of all of the purchasing that's been happening, all of those items are being currently restocked and brought in from across the country into Long Beach and into the rest of the state. And so the items that you need will continue to come in. And so we're asking people to please not hoard items. There are folks that desperately need supplies and that need access to good and healthy food. And I want to thank all of the grocery stores and markets that we've been working with, most of which now have implemented special hours for seniors, people with disabilities, other vulnerable populations where they can shop in a more calm environment. And so if you reach out to your local grocer or go online, please know that most of them now have special hours, and you can find those or by calling the actual grocer. Want to reiterate also that Long Beach Unified School District continues to serve hot meals for breakfast and lunch all throughout this week. That is happening from 8 to 9 at school sites in the morning and from 11:30 to 1 in the afternoon. They will continue serving food next week. Some of the locations might change and there might be some consolidation, but they will be putting that information out. But this is available to all students. And so whether your child goes to Long Beach Unified or not, you are able to go to any of these schools, and we will be happy to partner. And the school district is excited to share their resources with the entire community, and we're very grateful. As a reminder, both Cal State Long Beach and Long Beach City have transitioned to online classes for students and parents. Let me also touch on utilities for those folks that are concerned about not being able to pay their water bill or their local Long Beach gas bill. Those Long Beach utilities, we will not be enforcing payment over the course of this emergency. And so please, if you cannot pay, we are not going to shut off your water or your gas. We will work with you on some type of payment plan or program moving forward. This is also the case for most other non-city utilities or functions. So whether it's Southern California Edison or whether it might be a cable provider, most companies are providing relief for residents. And we've been working with them, and you can please contact them and get that information. Before I turn this over to Ms. Holman, I want to just add that we are in a very serious health crisis, and what is happening on the ground and the information that we're putting out is changing rapidly. I want people to understand that social distancing, staying at home, trying to be away from folks gathering is really important right now. If you're seeing what is happening in Italy or other parts of the world, this is a very serious, with a very serious crisis that we're in right now. I will also add that folks across the city of Long Beach need to expect that at some point in the very near future, it could be later tonight, likely, could be tomorrow, we will be putting out some additional health guidelines and health orders from the Long Beach Health Department that go beyond what we've already put out. And so to be clear, people need to expect that the restrictions that are currently in place for the city of Long Beach are going to get tighter, and we're going to have more instructions for the community over the most likely this evening. And so please continue to watch the social media, online, also television, and as we put out this information. And so that is really important for the community to know. And I ask people to please follow every health order that is out there, which currently includes bars being closed, gyms being closed, restaurants serving only takeout and to-go, movie theaters being closed, and a bunch of other things. And that is going to continue, and we'll have more information on that later tonight. Before I answer questions, I'm going to have Emily Holman make some comments. We're going to do some translation, and then I'll get to some questions as well.
Thank you. As Mayor Garcia shared earlier, there are now 3 cases who have recovered from COVID-19 in Long Beach. This means 2 things. First, the cases themselves have recovered in the sense that they're feeling better. They're back to their baseline good health. It also means that they are no longer contagious, so they no longer have to stay isolated at home, and they are no longer at risk of transmitting the virus to anyone else. While this is great news, we still want to prevent as many infections as possible. We are encouraging everyone in Long Beach to take actions to reduce physical contact with others in order to slow the spread of COVID-19. This means being vigilant about practicing social distancing over the next several weeks. Even if you are young and healthy and you're not particularly worried about contracting COVID-19, we worry most about the people you may unknowingly pass it to that may not be as healthy as you and could experience severe disease. For this reason, we ask that everyone practice social distancing for the safety of our general community. Even though we're practicing social distancing, we should find other ways to stay connected as much as possible. We don't want anyone to feel alone right now. It's still okay to go outside, to walk your dog, to ride your bike, and get fresh air. We just ask that if you see others while you're out there, just stay at least 6 feet away from them. Please remember to check in often on family members, friends, and neighbors by calling when possible, or texting, or FaceTime, or sending an email. Of course, we all need to continue to do a good job washing our hands for at least 20 seconds, and we should also be cleaning surfaces and other items that we handle often. If you yourself are sick and believe you're experiencing symptoms of COVID-19, which include cough, fever, and shortness of breath, you should call your healthcare provider rather than go to see your provider, because you may be exposing others to the disease if you go to see your doctor. So you should call your healthcare provider before seeking medical care so that appropriate precautions can be taken. Those who do not have a provider can call our public health info line at 562-570-4636. We all have an important role to play in helping slow the spread of this disease. What you do does matter now, especially when it comes to keeping our most vulnerable people from developing serious illness from COVID-19. We can't do this without your help. Thank you for helping our community in this major public health effort. Please find more information on COVID-19 at our website, www.longbeach.gov/COVID-19. Thank you.
Thank you, Emily. And we're going to have Teresa Castillo do some translation in Spanish for us, and then we're going to get to some questions.
Muy buenas tardes. Es muy importante que ustedes sepan que tenemos toda la información preparada para ustedes y estamos aquí para informarles a la comunidad de todos los esfuerzos que está haciendo la ciudad de Long Beach. Esta tarde estamos aquí para responder respuestas de COVID-19. Ahorita tenemos 12 casos positivos en Long Beach. Lo que es importante de saber es que 3 de esos casos están mucho mejor y están recuperados. Eso quiere decir que ya no tienen síntomas y que no están contagiosos al resto de la comunidad. Tenemos como 130 personas que estamos monitoreando. Es muy importante que nosotros sepamos que estas personas tienen que estar en cuarentena. La ciudad de Long Beach está tomando decisiones muy importantes a este momento para proteger su salud de sus negocios y de sus hogares. Estoy muy orgulloso de decirles que el marzo 17 nuestro concejal votó para hacer un programa para la ciudad de Long Beach y las familias que están afectadas y que tienen negocios pequeños por el outbreak de COVID-19. Ahorita vamos a poner moratorio en todas las evicciones de personas que tienen hogares en Long Beach que no pueden pagar su renta y que tal vez tengan problemas pagando a tiempo. Vamos a hacer un programa de emergencia para todas las familias que no puedan mantener sus negocios pequeños o que no puedan ir a trabajar por esta enfermedad. Todos estamos trabajando muy pronto y rápido para buscar otros métodos para ayudar a la ciudad de Long Beach. También estoy muy orgulloso de hablar de un nuevo plan que estamos trabajando con el Long Beach Community Foundation que va a ayudar a las personas afectadas por coronavirus. El programa se va a llamar Corona Relief Fund. Si usted quiere, puede hacer una donación a este importante fondo por texto y la información es Support LB o puede ir al website longbeach.gov para más información. Nuestra prioridad es asistir a la comunidad de la ciudad de Long Beach, a todos los negocios y a todas las personas afectadas por este virus. Al último le quiero decir que es también muy importante que sepan que todas las tiendas tienen suficiente comida. Ahorita está un poco corto porque no pueden ir todos a la misma vez a comprar, pero yo he ido y he trabajado con todos los dueños de las compañías grandes y ellos están diciendo que van a tener más comida muy pronto. So, es muy importante que por favor solo compre lo que necesite y que deje el resto de las cosas allí, comida, productos para limpiar para toda la gente, porque sí va a haber más. Les necesito que solo compre lo que necesite y deje para las personas que van a necesitar igual. También les puedo decir que las escuelas van a dar desayunos y almuerzos para todos los niños esta semana y la semana que viene. Después de eso van a continuar, pero puede ser que sean a diferentes sitios. Todas las escuelas no van a poder mantener este programa, pero sí van a haber escuelas que tienen almuerzo y desayuno por el resto de este tiempo. La universidad y las escuelas están cerradas, pero todos los maestros están trabajando para tener programas para que los niños sigan aprendiendo. Las escuelas están trabajando con los maestros para tener programas que los niños puedan asistir vía la computadora. También les quiero avisar que todas las utilidades como el gas y la electricidad no van a ser apagadas. Si es que usted tiene problemas en pagar sus biles, puede llamar al Departamento de Gas y Agua y le van a asistir por estos siguientes meses para asegurarnos que nadie va a quedarse sin agua y sin luz. Es muy importante también que sepan que tienen que mantener su distancia. Es muy importante que sigan visitando el aire libre, que salgan, que hablen con sus vecinos, pero todos manteniendo 6 pies. Por favor, no vaya a restaurantes, porque ahora ya están cerrados, pero es importante que sí visiten a estos lugares. For takeout, comida pueden ir, pero no pueden ir a comer en los restaurantes. También les quiero decir que ahora o en los próximos días puede haber más información sobre restricciones. Ya ahorita no podemos ir al gimnasio, no podemos ir a restaurantes y puede ser que haya más restricciones que vengan de la ciudad de Long Beach. Es muy importante que escuchen estas informaciones y que por favor sigan la dirigencia del Departamento de Salud y del gobierno de la ciudad de Long Beach, porque todo eso están haciendo porque es importante para su salud. Gracias.
Thank you, Terry. And I think folks are probably aware that we have a very large Spanish-speaking only population in Long Beach, and so getting the information out in Spanish is really important. And the city is also working with our partners within the Cambodian community to put direct information out. We also have, while it's not as large and it's a smaller population, we do have a Khmer speaking only population, and the city is working to get Khmer information in Khmer out to the Cambodian community, as well as other languages. We have a very international and diverse city, so everyone needs to have the information and everyone needs to be informed. I want to, if there's a couple questions here, if there's any questions, I will happy to answer those. Kelly.
Yes, Mayor, what could these stronger guidelines look like in Long Beach, and is the city considering a shelter-in-place type mandate like what we're seeing in the Bay Area?
So the question was about any stronger orders or guidance as it relates to shelter in place from the Bay Area. So what I can say is that the City of Long Beach is working right now in partnership with our county partners. And one thing that has been the case is that every day that goes by, your city has been putting out more guidelines and more health directives as it relate to what we can and should not be doing. And I think that people should expect that to continue. And so as far as what this next set of guidelines are going to be, as soon as our health department has prepared those and they have been vetted through all of our partners and partnerships, that will be out. But as of today, what is in place is what we've already put out. But I should let folks know that they should be expecting additional changes to that and additional guidelines to be released, and those will be coming out soon. Haley.
Health officials reported this week that there was possible exposure at Willard Elementary School. Have there been any other incidents of potential exposure to in public or semi-public places people should be aware of?
So the possible exposure at Willard Elementary School, which has been reported, I know that our health department has been in constant contact with Long Beach Unified School District to ensure that families and parents and staff are aware of that. I will also just add that we're working very closely with Long Beach Unified and all of our school partners on this issue. As far as other types of forms of community transmission or other incidents where folks are connected, I know that the health department has a process that goes through to inform people, and I don't know if maybe, Emily, you want to kind of comment on what our process is on that?
Sure. Based on the person infected, we sort of get an idea. We do extensive interviewing with the person, and we get an idea of who their contacts are, but sort of how close of contact they had. So we have risk categories, and we sort of manage each contact based on that risk category. And so any sort of general letters we send out are usually based on an abundance of caution, and those who are at higher risk, we contact individually and sort of arrange something for them.
Kelly.
Planning to put out more information on people who've been infected, including age range and where they may have traveled within the city?
At this time, no, because we have to protect patient privacy. In terms of where they went in the city, it's not, like measles, that the virus lives in the air for hours after the fact. So there's no sort of risk of public exposure if you go into a supermarket, after someone that may have been infected or anything like that. So again, we sort of track where they went and figure out who may be at risk, and we contact those people directly.
And something that I think that Emily has shared with me and Dr. Davis as well is that there is an extensive outreach that happens, and so it's yes, they're looking at location, but it's really who that individual made contact with,
Yes.
where they were, exactly the locations that individual may have been in. And some information, the health department has released some information, and I think as soon as certain privacy guidelines are met, and quite frankly, CDC and federal guidelines that we're following that are set, as soon as those are set, when the health department is able to release information legally, they will do so and have, but we're also following a set of CDC and federal guidelines on the process. I will just give you an example. One person that can get COVID-19, it could take the health department over 100 other interviews or contacts that they are speaking with just off that one person, and they go out and talk to dozens of people that may have been in contact with that one individual, and so they're doing an extensive amount of work to track that.
Can you speak to the current testing capacity for residents in Long Beach, and also whether, or I guess how many investigations are ongoing to identify people who may have been exposed?
You want to take the lab question?
Yeah, I'll take part of that question, then maybe Emily can take the other part. I think the first thing that's important is that we are following CDC guidelines as to when to test and who we're testing. But I think it's important to be also honest about the capacity of not just Long Beach, but other health departments or other localities or states. So we have a limited amount of tests available to us. When we don't have when we didn't have the test, a week or so ago or any, we were working with partners to do those tests. I believe in Orange County and LA County and other hospitals and labs. So the testing was happening, but the reality is that we need more tests, a lot more tests. And I'm getting a lot of residents, rightly so, asking where are the drive-through tests? And I have the same question, where are the drive-through tests? We will be able to do those testing sites once we get a significant amount of tests from the federal government. I shared that we have obviously cases that we have confirmed, and 12 total so far. That doesn't mean there are only 12 people in Long Beach that are positive for COVID-19. I suspect that number is much higher than that. But until we are able to test more individuals, we just don't know. And so the more tests that we receive, the more we'll be able to gauge how serious the challenge is in front of us. But I suspect it's pretty serious. And that's how we have to operate, which is why social distancing, regardless of the fact that the number is 12, that is a number of those that we've been able to test and confirm. Emily?
Yeah, and just to add to that, with our very limited testing capacity, we are prioritizing those at highest risk for developing severe symptoms, and those who, for example, in sensitive occupations such as healthcare workers, because if they were to become infected and pass the virus on to their patients, it could potentially result in very severe outcomes. And so with the limited tests, we have been prioritizing the highest risk people. And I understand the community's frustration, but in general, if people are feeling sick, if they stay home and self-isolate, that would be the exact same thing we would ask them to do if we knew they had COVID-19. So although we do want to know what we have going on in our community, the sort of results and action that we would ask people to take wouldn't change much if we did know they had COVID-19.
Absolutely. And let me add also that I think as cities, this is not a Long Beach, an isolated Long Beach challenge. I mean, we're talking to mayors across the state of California. Everyone is demanding more tests. Everyone wants more test kits. We do not have enough, and so I think that process continues, and we're going to continue to advocate for those. So unless there's anything else, I'm going to wrap up. Kelly.
The city, I believe, they said last week received about 1,000 test kits. Do we have any numbers of how many people have been tested so far?
No, not right now. I don't have a number right now, but
we'll get that.
Yeah.
And I'll just add that it's not just about the test kit.
Yeah.
But we can be sent many test kits, but there's also, and maybe Emily, you can explain, but we also need to have not just a test kit, but there's another piece of it.
There's several other pieces to it, and like Mayor Garcia mentioned, there's shortages of these certain pieces that you need to be able to run this test. And so even if we have 1,000 test kits, it doesn't necessarily mean that we can run 1,000 if other sort of parts to that test are short as well.
Last question.
Sorry, can you just speak to the investigations that are ongoing to identify people who may have been exposed, and how many people you may be interviewing, or any details you can provide on that?
Sure. So all 12 of our cases, we're in daily contact with, although once they've cleared, then they're free of us. But so we're in daily contact with our cases and also their contacts. So in terms of I was talking about the different risk levels earlier. Those in the highest risk category, such as household members, people who had very close contact to infected people, we call them daily and check in on them and ask them about symptoms. And if they do start to develop symptoms, we have a plan for them and we can try and get them tested. So it's a process that we've used for years. It's what we do on a daily basis for other diseases. So it's not a new process for us, and it's something we're very familiar with.
Great. So I'm gonna kind of wrap up with a recap and then close. Just as a recap for Long Beach, I want to thank everyone first for their patience and their support. We have 12 confirmed cases. 3 are on the road to recovery, which we're happy about. We are anxious, of course, to get more tests and to set up some of the larger testing systems that are in place. We have launched, finally, a community foundation relief fund to help people with disabilities, seniors, low-wage workers. There is an eviction moratorium if you are a renter in place right now, as well as around utilities. We're not going to be shutting off utilities if you can't pay, and more economic incentives are on their way. Again, there is no food shortage. Food is on its way from all the manufacturers. Groceries are coming. School breakfast and lunch are still served at our school sites. Crawford Long Beach Unified. Again, we are not doing street sweeping parking tickets this week. That is the recap, and I'll just close by asking everyone in Long Beach to please take what's in front of us very, very seriously. You should be, and we should all be concerned about how long this might last, and the sooner that we can all self-isolate, stay at home as much as possible, not be around crowds, and take care of ourselves, the shorter this will be. But I want to be very honest with folks that people should expect this to take some time, and we need to hunker down, have a plan with your family, how we're all going to take care of each other. Please try to limit socializing and continue to take care of each other in the community. And so thank you very much. We'll continue to have these updates. And again, there will be additional guidance and updates in the very near future. So thank you very much.